day. Myself is Periyar Selvam, working as an associate professor in the Department of Food Process Engineering, SRM Institute of Science and Technology, Kattangalathur. Welcome to the Department of Food Process Engineering YouTube channel. In this current session, I will brief about the foodborne infections. Foodborne diseases or illness occur through the consumption of contaminated food. In generally, it is going to be called as food poisoning. In other terms, foodborne diseases are acute illness associated with the recently consumed contaminated food. Foodborne diseases are majorly classified into two types. One is foodborne infections and another one is foodborne intoxications. The difference between foodborne infection and foodborne intoxications are foodborne infection caused by bacterial, viral, and parasites, whereas foodborne intoxications caused by toxins, natural toxins, microbial toxins, and chemicals. The pathogen or microorganism invade or multiple in the lining of intestine and cause the infection in the foodborne infection, whereas in the foodborne intoxication there is no invasion or multiplication of microorganisms. The incubation period for foodborne infection is hours to days, whereas foodborne intoxication, the incubation period is minutes to hours. The symptoms for the foodborne infections are diarrhea, nausea, vomiting, abdominal cramp, and fever. The symptoms for foodborne intoxications are vomiting, nausea, diarrhea, weakness, along with that respiratory failure. The foodborne infections are communicable disease. It transfers from one person to other persons. In the case of foodborne intoxication, there is no communicable disease. It's not transferred from one person to other person. The factors of foodborne infections are inadequate cooking, cross contamination, poor personal hygiene. In the case of foodborne intoxication, factors are inadequate cooking and improper handling. Some of the important foodborne infections are caused by bacterial infection, viral infection, and protozoal infection. Some of the bacterial microorganisms causing the foodborne infections, example, Salmonella typhi, Salmonella paratyphi, Vibrio cholerae, Shigella species, Listeria monocytogenes, Clostridium species, E. coli, or Escherichia coli, and Staphylococcus aureus, etc. The example for viral foodborne infections are hepatitis A and E and norovirus, that is a winter vomiting virus. The example for protozoal foodborne infections are Amoeba histolytica and Giardia. Some of the foodborne intoxications are toxins and chemicals. The toxins example mycotoxin, that is aflatoxin produced by the fungi Aspergillus flavus and Aspergillus parasiticus, and marine biotoxins, some of the marine products having the toxins, and some of the mushrooms having the toxins. It's called as a poisonous mushrooms. And plant intoxication, some of the plant part also having the toxins and chemicals, example pesticides. And toxic metals are mercury, arsenic, lead, cadmium, and cyanide. One of the common foodborne bacterial diseases are typhoid and paratyphoid fever. It's going to be called as a enteric fever. The enteric fever is caused by Salmonella typhi and Salmonella paratyphi A and B. The incubation period is usually 2 weeks, but in case of typhoid fever, it's between 3 to 28 days. In case of paratyphoid fever, it's between 1 to 15 days. The abdominal symptoms are severe. The fever and illness may continue for 4 weeks. The bacteria can be transmitted by the contaminated food materials like water, milk, and other food material. The Salmonella typhi or Salmonella paratyphi is transferred from one food material to other material through the flies. How we have to control the enteric fever means we have to maintaining the hygienic control of food and water supply and detecting and treatment of chronic carriers and vaccination using the TAP vaccine, that is a mixed culture of Salmonella typhi and Salmonella paratyphi A and B. The vaccine protect up to 5 to 7 years. Shigellosis or bacillary dysenteries are caused by Shigella dysenteriae, Shigella flexneriae, Shigella bovidii, Shigella shoni. All the strains of Shigella possess potent enterotoxin and the infection dose is smaller than that of Salmonella. The infection is started to begin from day 1 to 4 days and after ingestion of bacteria and may last from 4th day to 7th day. The symptoms including watery or bloody diarrhea, fever, stomach cramps, nausea or vomiting, dehydration and prostration in a severe cases. The diarrhea started with the thin water discharge and quickly loses its fecal characteristics and later only it discharged the pus, mucus, thread and blood. Death from bacillary dysentery infection is uncommon if you treat it properly. However, Shigella dysentery infection have been reported to have fatality rate of 20% and most of the fatalities occur in the children rather than the adults. The important foodborne infection is cholera. The cholera is caused by Vibrio cholerae. The cholera infection occurs as a natural infection and the dosage is usually very small. The organism multiple in the small intestine and producing very potent enterotoxin and man is the only natural host of the cholera and spread of infection is from one person to other person. It's a communicable disease and also through the contaminated food water, milk and other food sources. Cholera outbreak occur either as a explosive epidemic and it going to be caused the group of people in the particular regions. The cholera is typically characterized by the sudden onset of effortless vomiting and profuse watery diarrhea. The vomiting is seen frequently but very rapid dehydration and hypovolumetric shock is going to be occur. And what is the hypovolumetric shock means? If the body loses very huge or large amount of blood or fluid and it leads to unable to pump the blood to other part of the body. The frequent watery stools may be accompanied with a small part of the mucus being liberated from the intestines. The death may occur in 12 to 24 hours in the case of cholera infected person due to the rapid dehydrations. The patients may be produced up to 20 to 30 stools per day and losing many liters of water and electrolytes. The patients therefore exhibits extreme dehydrations and the urine is suppressed and the skin become wrinkled and the eyeballs are sunken and the voice become weak and husky. The next foodborne infection is Listeria monocytogen infection. Listeria monocytogen is a gram-positive bacterium that is pathogenic to both animals and as well as human beings. It is a opportunistic pathogen. Listeria monocytogens occur after consumption of contaminated Listeria on raw vegetables, salads, raw milk, meat and meat products, ice creams, poultry, sauerkraut, salads, and seafoods. The ready-to-eat foods are more possible for the contamination of Listeria infections. Listeria monocytogen causes abortion in pregnant women and meningitis in new infants and immunocompromised adults. The pregnant women and infants and elderly peoples are particularly high risk for the infection of Listeria monocytogens. The infection is fatal and with a mortality of 25 to 30%. Deaths have been reported in neonates. There are 5 key points to avoid the foodborne diseases. The first one, keep clean. Wash the hand before handling of food and often during the preparation of food. Wash and sanitize all surfaces and equipment used for the food preparation. Protect the kitchen from insects and pets. The second key point, separate the raw and cooked food and separate the raw meat, poultry and seafoods from other foods. Use the separate utensil for handling the raw foods and store the food in container to avoid the contact between raw and cooked food. And third key point is cook thoroughly, especially when you are cooking meat, poultry, egg and seafoods. And bring the soups and stew to boiling above 70 degrees Celsius before serving. Preheat the cooked food thoroughly before serving. The fourth key point, keep the food at safe temperature. Do not leave cooked food at room temperature more than 2 hours. Promote the refrigeration of cooked and perishable foods and do not store the food too long even if it is refrigerated. Do not thaw the frozen food at room temperature. You can use the proper frozen method to avoid the contamination. And fifth point, use safe water and raw material for cooking and select the fresh and wholesome fruits for cooking. Choose the food processed for safety, example pasteurized milk. Wash the fruits and vegetables if eaten raw. Do not use the food beyond expire date. So you have to follow these five key points to avoid the foodborne diseases. In conclusion, to ensure the food safety by keep clean, example cooking area and personal hygiene, separately store the raw and cooked food, cook thoroughly based on the required temperature, store the food material at required specific temperature, utilize or employ the treated or filtered water for cooking and processing of food preparation, follow the safety measurement and avoid or prevent the foodborne diseases. Prevention is better than cure. Thank you for watching. Thank you.